Hi there, it's Dr. Tuakli. No white coat, no formality, just want to have a chat with you about COVID-19. COVID stands for Coronavirus Disease 2019 because that's when it started. It was a new vaccine, a new virus, and we all know where it came from, and we know that it spread throughout the world and is causing a lot of devastation. What I want to talk about today are the symptoms of the disease that are caused by this virus, the coronavirus. It's called the coronavirus because it looks like a crown. So the symptoms that a lot of patients are complaining about sort of resemble the flu initially. Muscle aches, not feeling so good, very tired. But then it rapidly moves into a different phase that you don't find with the flu. Some people say they lose their sense of taste and smell, or they develop a bad cough. A very characteristic symptom of the COVID virus is a fever. Not a fever like with the flu of 104, 103 that really spikes real high and then it's over with. It's more of an insidious type of temperature elevation, which may hang around for over a week. So one of the ways to determine if you might be getting sick with COVID is to monitor your temperature. If you have a thermometer at home, then that's fine. They seem to be a little hard to get these days. But an elevated temperature is usually a symptom of COVID. However, it's not always there. There are some people who have characteristic symptoms of the COVID virus, but they don't have any fever. So you can't just bank on having a fever to determine whether or not you have COVID-19. Another very characteristic symptom is a cough. For some reason, this virus has a predilection for the lungs. And this is where it's really important, because most of the deaths that occur are because of respiratory failure, which is then followed by all the other organs shutting down. One of the things I recommend in prevention, and I'll talk about prevention in another video, is to do deep breaths. Try to keep your lungs really healthy, really working. But the cough is a very deep cough. So if you have a deep cough and a fever, and you feel like you've got the flu, you probably should get tested. Obviously, if you have been in contact with someone who has been COVID positive, you should also get tested. Other symptoms seem to occur in the gastrointestinal tract, but these are not major. It's not like a running diarrhea, but people do notice that their bowel movements are changed. They may be a little nauseous. And there is a concern about people shedding the virus in their stool. This is why one of the recommendations is that you close the toilet lid when you flush, if you're in a household with someone who is COVID positive. I hope these tips have been helpful. And the other symptoms that occur tend to be very non-specific, meaning that basically anything can happen, and every single patient who's had COVID has shown all kinds of other symptoms, including neurological symptoms, that is, symptoms that affect the brain. But these are much rarer. So if you have any questions about symptoms or any other aspect of COVID-19, please write to me, ask me the questions, and I'd be happy to answer them. In the meantime, stay informed, and I wish you well.